US pharma company Eli Lilly has finally launched the much-awaited blockbuster diabetes and obesity management drug Mounjaro in India. Mounjaro, which is a weekly injection for obesity and type 2 diabetes after obtaining approval from India's Central Drug Standard Control Organization or CDSCO, has finally made its debut in India. Already there was a lot of anticipation about this drug as to when will it finally come to India. There is already a lot of anticipated demand that is existing in India. Is finally going to be seeing this drug enter into this competitive space as well. In fact, what we've already seen is that in US and in Europe, this drug has been huge in demand. It has proven successful in many cases of diabetes and obesity, and finally it makes its entry in India. But how much will it cost? The prices have been told to us by the spokespersons of the company. A 2.5 milligrams vial of the Mounjaro injection will be priced at 3,500 rupees, while the 5 milligrams vial will be priced at 4,375 rupees as well. Remember, this actually will bring a monthly cost for somebody who will be taking a weekly injection to anywhere between 14,000 rupees to 17,000 rupees, depending on the kind of recommendation that your own doctor will advise you looking at your condition. But remember, the prices are far more affordable than what we have seen on the global platform. In US, for instance, this same drug is priced at anywhere between 86,000 rupees to 1 lakh for a patient for 1 month. And the stark contrast clearly indicates that Eli Lilly is serious about bringing, affordable drug to Indian diabetes and obesity patients. Now, what we are already seeing is that there are a lot of questions as to how will this drug really function. Remember, Mounjaro is the first drug to activate both GIP and GLP-1 receptors. This will boost insulin secretion, improve sensitivity, suppress glucagon, and regulates the appetite for weight loss and better metabolism as well. That's what we are given to understand too. And Eli Lilly has already talked about their commitment to ensure the access to innovative treatments in India as well. Now, what else are we going to be seeing? What is the kind of example that we have seen worldwide of the success of the usage of this drug? Now, in a 72-week clinical trial, patients using Mounjaro alongside diet and exercise have experienced weight reductions of up to 21.8 kilograms at the highest dose, that is 15 milligrams as per the company's claims. They have also said that in case you've taken the lowest dose, that is of 5 milligrams, then the weight loss has been to the tune of 15.4 kilograms too. Now, remember, there is this rising demand for GLP-1 receptor agonists which have created a multi-billion-dollar market for diabetes and obesity treatment, semaglutide-based drugs, just like how Novo Nordisk's Rybelsus has also seen a 65% of India's anti-obesity market already. And now the competition is set to grow with Eli Lilly finally entering as well. Now remember, why does it mean that this is going to be a huge space that Eli Lilly is now wanting to capture in India? Because in India, 101 million diabetics are reported with 100 million obese adults. They all face health crisis. There are also poor glycemic control affecting nearly half of the diabetics. There is obesity, which is rising the risk for over 200 conditions as well, including heart disease, hypertension. And this is what Lilly India has reported. Their president and general manager has clearly pointed out, and this is what has made a promising case for Eli Lilly to bet big on the India market there, so to speak. Now, what we are also given to understand is that exactly who is going to be important to really look at this space. We are the second largest population of people living with diabetes. We have 100 million people of a population which has diabetes. Obesity is a major risk factor that is being reported in India too. And what we are also seeing is that people with coronary heart diseases, people with hypertension, people with obstructive sleep apnea, because of diabetes and obesity, will be looking at to take this drug as well. How soon will this be available as a drug in India? Well, the company spokesperson of Eli Lilly has told Business Today television that this drug will be available in weeks from now. So the availability will actually not take too much of a time as well. We also did ask the company as to if there are going to be any kind of side effects that they are cautioning against to the patients. Well, they are saying in the question that we put forward to the company that patients taking Mounjaro, like with other prescription and the medicines that they are taking, may experience some adverse events. The most common side effects will be nausea, diarrhea, decreased appetite, vomiting, constipation, indigestion, and abdominal pain in some cases. They say that these side effects are similar to those of GLP-1 receptor agonists already, which is available in India, and such as the liraglutide, the dulaglutide, the oral semaglutide. So such medicines in the oral format are already there. No unusual side effects have been made or spoken about by them. What they are also saying that what will be the kind of usage when we ask them what is the recommended dosage of such a drug for Indian patients. They have pointed out to our question saying that the regimen for taking this drug starts with 2.5 milligram once weekly, with an up titration of 2.5 milligrams every 4 weeks, reaching a maximum dosage of 15 milligrams once weekly. The 20-week titration is used for both type 2 diabetes and chronic weight management, and the recommended maintenance, which you will have to maintain as a dosage after your treatment, are 5 milligrams, 10 milligrams or 15 milligrams injected subcutaneously once weekly, both for type 2 diabetes and chronic weight management. This is what they have told us specifically on Business Today television as well. Now, of course, how will you be able to get this drug? They have clearly mentioned that Mounjaro will be available upon obtaining a valid prescription in registered pharmacies in the coming weeks as well. But this clearly seems to be a big breakthrough for India and Indian patients of diabetes and obesity, looking forward to this blockbuster famous weight loss drug that was already making headlines world over, but now will be available to Indian patients. It now remains to be seen how the competitive intensity will go forward into this space going forward from here, because remember, a lot of Indian companies have already started to work around their own drug formulations around the same area as well. This space is only going to go bigger, but we'll just have to see how things take shape, because this has been a big breakthrough in terms of the pricing that Eli Lilly has done. So more affordability is going to be centric for the Indian patients. We'll see how the success of this medicine takes shape over the next few weeks, months and years to come as well. Stay tuned on Business Today television, as we will be continuing to get you all the insights that you need to know about what's buzzing in the world of weight loss drugs.
Ladies and gentlemen, we